పావుగంటలో వస్తుంది.
A very good evening to all of you. Wishing you a very happy Deepavali. Let us begin with our multiple choice question challenge. Today we are dealing with pathology. So hope you are all celebrating. But just for this 15 minutes, 15 to 20 minutes, we will quickly do this pathology. Please make this interactive by giving your correct answer in the chat box. So, most common site of brain metastasis is A. Brainstem, B. Cerebellum, C. Cerebral cortex, and D. Thalamus. So, what is the most common site of brain metastasis? Most common site of brain metastasis is, what do you think is the correct answer here? Is it the brainstem? Is it the cerebellum? Is it the cerebral cortex? Or is it the thalamus? Any guess, please? Please type in the chat box, please. See, it is the cerebral cortex where the metastases occur. These metastatic brain tumors are the most common tumors of the brain. The distribution of metastasis in the brain is directly related to amount of blood flow to each part of the brain. 80% of brain metastasis occurs in the cerebral hemisphere, mainly the frontal lobes. 15% occurs in the cerebellum and 5% occur in the brainstem. The most common primary sites are lung, 50%, followed by breast cancer, 15 to 20%. Unknown primary causes, 10 to 15%, melanoma, 10%, and colon cancer, 5%. Metastases to the brain are multiple in more than 70% of cases, but solitary metastases do occur. Dural metastasis, which may constitute as much as 9% of total CNS metastasis. So it is the cerebral cortex. Let us move on to the next question. Well, which of the following is inherited as an autosomal recessive form? From the image, you can see autosomal recessive form. This autosomal recessive form is seen in which disease? This sickle cell anemia is an autosomal recessive. Now, what about hemophilia? Hemophilia is X-linked recessive. Hereditary spherocytosis, again, most repeatedly asked, it is autosomal dominant. And G6PD deficiency, again, it is X-linked recessive. So, hemophilia and G6PD deficiency are X-linked recessive. Sickle cell anemia is autosomal dominant, and hereditary spherocytosis is autosomal dominant. So, sickle cell anemia is autosomal recessive, and hereditary spherocytosis is autosomal dominant. So, sickle cell anemia is autosomal recessive. So, correct option here is A. Anti-transglutaminase antibody is seen in Anti-transglutaminase antibodies is seen in A. Celiac disease, B. SLE, C. Collagenous colitis, D. Tropical flu. Celiac disease. The correct answer is celiac disease. Asymptomatic celiac disease with selective malabsorption is found with increased frequency. The diagnosis can be made by testing for anti-gliadin, anti-endomycin, or transglutaminase antibodies, but may require endoscopic biopsy. Is you can give a trial of gluten-free diet, and if it resolves, it can be confirmatory. So it is celiac disease. Shock lung. Shock lung. What do you think about shock lung? He is characterized by A. Alveolar proteinosis, B. Bronchiolitis obliterans, C. Diffuse pulmonary hemorrhage, and D. Diffuse alveolar damage. Shock lung is also called as ARDS. In shock lung, there is diffuse alveolar damage due to acute alveolar injury, which is equivalent to acute lung injury. The lungs here are heavy, firm, red, boggy, and exhibit congestion, interstitial and intraalveolar edema, inflammation. The alveolar walls become lined with waxy hyaline membrane that are morphologically similar to those in hyaline membrane of neonate. Hyaline membrane contains fibrin-rich edema, fluid mixed with cytoplasmic and lipid remnants of necrotic epithelial cells. So it is diffuse alveolar damage. Demyelination is the major feature of multiple sclerosis. Which of the following cells form myelin in the central nervous system? A. Astrocytes, B. Ependymal cells, C. Microglia, D. Oligodendrocytes. It is oligodendrocytes. Renal angiomyolipoma is associated with A. Tuberous sclerosis, B. Neurofibromatosis type 1, neurofibromatosis type 2, D. All of the above. It is tuberous sclerosis. What other things can occur in tuberous sclerosis? Retinal tumors can occur, cardiac rhabdomyoma can occur, and renal angiomyolipoma can occur, renal carcinoma metastatic can occur, polycystic renal disease, simple multi. So it is tuberous sclerosis. HER2 June causes breast carcinoma due to A. Overexpression, B. Suppression, C. Mutation, and D. Translocation. It is gene amplification and overexpression. Sorry, it has been wrongly marked. It is overexpression. Activation of which gene leads to bladder carcinoma? It is P53. Gene associated with superficial papillary urothelial neoplasm is P16. Reversible change from one cell type to other is known as A. Hyperplasia, B. Hypertrophy, C. Metaplasia, D. Dysplasia. It is metaplasia. Cells seen in cutaneous T cell lymphoma are called A. Councilman bodies, B. Bar bodies, C. Sézary cells, D. Dolism. These are Sézary cells. Pancreas tumor is A. Superior sulcus tumor, B. Inferior sulcus tumor, D. C. Median sulcus tumor, D. None of the above. It is superior sulcus tumor. Histological picture of a lesion excised from cervical lesion is shown below. What is your diagnosis? It is necrotizing granulomatous inflammation. Which of the following is a likely diagnosis based on smear given above? It is acute myelogenous leukemia. The most important investigation in the given case to diagnose if the condition is a neoplasm is JAK2. Sterile, non-destructive vegetation present on mitral valve is non-bacterial thrombotic endocarditis. The given biopsy from intestine suggests A. Squamous cell carcinoma, B. Adenocarcinoma, C. Adenoma, D. Colorectal carcinoma. It is adenoma. SS18 SX7 gene associated with A. Liposarcoma, B. Rhabdomyosarcoma, C. Synovial sarcoma. It is synovial sarcoma. WHER syndrome includes all Wilms tumor, anuridia, growth retardation, mental retardation. It is growth retardation. It is genitourinary abnormality, not growth retardation. So with this, we wrap up with pathology. I will come with the deep explanations again. Wishing you all the best. Click the link in the description box. I wish you a very happy Diwali, and may your the first lot of light come into your life, and may you all be successful. Wishing you a very all the best. So meet you tomorrow again at 7 p.m.